Hello, this is a video about flying phobias and what can be done to help a person that has a flying phobia. Now, a phobia is a fear response to a specific stimulus. Phobias typically elicit a fear and escape response from phobic individuals, as well as avoidance behaviours. Fear of flying is a very common specific phobia affecting upwards of 15% of people in Western countries. Flying phobias can have seriously disruptive effects on people's lives. Individuals have been known to give up job opportunities, miss family gatherings and avoid holidays that require a plane trip. Flying phobias cause embarrassment. They erode self-esteem and they motivate some people to mix drugs and alcohol in order to take flights. Fear of flying is becoming more common the world over as people fly more often. Now, the good news is that there is something that can be done to alleviate or even eliminate a person's fear of flying. Behaviour modification is a school of psychology that offers a range of effective strategies to assist people to conquer their flying phobias. My name is Glenn, and I'm a student at the University of New England, and I would like to tell you about the steps that can be taken to help a person with a flying phobia greatly reduce their flying-related anxiety. Now, studies have shown that a combination of intervention therapies are most effective. The first step is to identify a goal, such as taking a flight or flying without using drugs or alcohol. The second step is assessment, and this can be done through specific questionnaires designed to assess fear of flying, such as the Flight Anxiety Situations Questionnaire or the Flight Anxiety Modalities Questionnaire. Next, it can be very helpful to provide a relevant example of someone overcoming a phobic fear, but importantly, not an example that includes the stimulus that the person currently fears. There are some excellent examples to be found on YouTube. The next step is to use a form of exposure therapy known as systematic desensitization. This is where the person is exposed to feared situations through imagery. Exposure therapy works through a process of habituation, where through repeated exposure to a feared stimulus, the person experiences lower levels of anxiety, much like jumping into cold seawater. At first it's unpleasant and you want to get out, but if you stay a while, you habituate to the temperature and the water becomes pleasant. Hence the saying, it's nice once you get in. With repeated exposures, patients experience reduced sensations of fear. They learn new associations with the feared stimulus, and they gain self-efficacy as they are better able to handle their fear responses. They also generate new mental interpretations of previously feared stimuli. To begin with, a fear hierarchy needs to be created. This is essentially a graduated list of feared stimuli with fear ratings against each situation. The fear rating is called a SUD scale, which stands for Subjective Units of Discomfort Scale, and ranges from 0 to 100. 0 being no fear at all, and 100 being the worst fear the person can imagine. It's sometimes called the catastrophic fear. The scale starts with situations that are mildly averse to the person, such as media reports of plane-related incidents, and moves up the fear scale to more feared situations like being in a plane as it taxis up the runway. And then finally to the top of the fear hierarchy, to the most feared situation, which is typically being in a plane crash and dying. The person can either close their eyes and imagine the feared stimulus, or it can be described to them. Systematic desensitization works by exposing the person through imagery to each situation until their fear rating falls to around half of its original level. Once this is achieved, you move up the scale and you start exposure to the next stimulus. This continues like climbing a ladder until all the SUD levels have fallen by half. Empathy, praise and encouragement are used to give the person support. It can be surprising how much discomfort and fear can be produced by exposure to imagery to a feared stimulus. It's also important to record the change in the SUDS levels. The next step is to use video exposure. The person is exposed to a video of a real flight from beginning to end, and there are many of these on YouTube taken from the perspective of a passenger. This allows the person to really immerse themselves in the sights and the sounds of a flight, and to habituate to these sights and sounds, and so prepare themselves to take a flight with much reduced anxiety. The next is another form of exposure therapy called in vivo desensitization. In vivo desensitization works on the same principles as systematic desensitization, except the exposure is to real-life stimuli. Once again, a fear hierarchy is established with mildly feared situations at the bottom, like buying the plane ticket or driving to the airport. At the top of the fear hierarchy is the goal of the intervention, maybe to fly to visit a relative or to fly without any kind of sedation. Praise is used to reinforce the new behaviour of approaching each feared situation as the person climbs up their fear hierarchy. And simply touching the person on the arm, for example, can give them support and so help them to habituate to each new situation. Now, many programs teach people relaxation or distraction techniques to reduce the anxiety they feel during in vivo exposure. These include diaphragmatic breathing and progressive muscle relaxation techniques. Now, the latest research on phobia treatment states that to achieve long-term success, the person needs to expose themselves fully to the feared stimuli until habituation is achieved. Now, this means that distraction and relaxation can be counterproductive and reduce the effectiveness of exposure therapy. Having said that, teaching the person relaxation techniques can give them an alternative strategy to use if they're experiencing severe anxiety on an intervention plane flight. A great strategy to use once the person is feeling relaxed is to film them on their flight and after they've taken the flight. Now, this is so that they can view the footage later on and relive their success. This can be really helpful in achieving long-term stability and durability of the intervention strategy. After all this is done, another set of questionnaires is completed by the individual to measure the reduced anxiety responses accurately. Thanks for listening, and I hope this helps people to realise that phobias are really quite common. They're nothing to be embarrassed about, and that there really are effective treatments available. If you'd like to do something about your flying phobia, you could try visiting your local psychologist to explore the idea of using exposure therapy. If you'd like to see a really great example of a person overcoming a snake phobia using these techniques, you can search for Lars Ost's snake video on YouTube. That's OST. Thank you, and I hope that this helps.